Dr. Neal, nice to see you. I enjoyed our conversation, our visit the other day. Let me just start with this. You're familiar, I think, with the recent insurance claim study regarding Mifepristone. Is that correct?
Yes, Senator. I've not read the study, but I'm familiar with it.
This is a study of 865,727 prescribed Mifepristone abortions, chemical abortions, between 2017 and 2023. It's the largest such study of Mifepristone ever conducted, the only major study conducted now in years. And as I think you know, the results were really quite startling. They showed that 10.93% of women who use the chemical abortion drug experience a major serious adverse health event like sepsis, infection, hemorrhaging, often necessitating emergency room visits, often leading to life-threatening situations. The real dramatic result of this, I think the takeaway of this is that this is a much, much higher rate of serious adverse health events than what the FDA currently reports, 22 times higher than what the FDA has currently reported. So my question is, in light of this new data, and it is true, it's an enormous data set, just an enormous data set, isn't it time for the FDA, number one, to put back in place the reporting requirements of serious adverse health events? As you know, in 2016, the FDA eliminated, at the behest of the Obama administration, eliminated the requirement that physicians and others report non-life-threatening but yet serious adverse health events. Shouldn't we put those back in place in light of this data?
Hey folks, welcome back to the channel. If you love America, if you love the truth, and you're tired of the mainstream media hiding what's really going on in Washington, you have come to the right place. Today, we're talking about something the radical left don't want you to hear. The real story behind the abortion pill, Mifepristone, and the shocking new study that exposes the truth about its dangers. So, Senator Josh Hawley, a real patriot, by the way, just grilled Dr. O'Neill, the Biden nominee, for a top health post. And folks, believe me, this was a masterclass in holding the swamp accountable. If you missed the Senate hearing, let me break it down for you, and let's get into why this matters for every American, especially if you care about the safety of women and the rule of law.
Senator, FDA has a responsibility to ensure that all drugs are safe and effective. And sometimes new data comes in and it needs a review. Mifepristone actually has a REMS, meaning it's been designated for a long time as something that needs periodic review of safety data. The Secretary has pledged to do a safety review of Mifepristone, and I strongly support that review.
Good, and you'll help him carry out that review, that safety review.
Absolutely.
And this study that is out just this last week just underscores the need for ongoing safety review and for a look, I think a fresh look at all the data. Would you agree with that?
It does look that way.
Yeah, and would you also agree that it's time for the FDA, as part of that thorough top-to-bottom review, to think about reinstating the other long-standing safety protocols on this drug? Until the Biden administration eliminated them, Mifepristone for 20-plus years had always required physician dispensing, in-person dispensing, physician follow-up visits. The Biden administration eliminated all of those things. Now telehealth providers, you don't even have to be in this country now to send this drug, to prescribe it, quote unquote. You don't have to be a doctor. You don't have to see your patient. You don't have to be in America. You can mail it into states regardless of state law, what state law is. And this is one of the reasons we're seeing such incredibly high adverse health events. Don't you think it's time to reconsider and to revisit putting back in place those longstanding safety protocols?
Senator, a lot of patients have a lot of trouble getting prescriptions filled across state lines, even medicines that have much less safety concerns than this drug. And of course, every approval that FDA does or reviews can state the appropriate and inappropriate ways of prescribing or dispensing a drug. And so all of that should be subject to review, absolutely.
Okay, good. All of it's subject to review. The Secretary was very clear on this, that he will conduct a full-scale safety review. He's required to by law, as you pointed out. But I think what this latest study shows is that the information that is coming into HHS, it's time that you took a serious look at the scope of that information, because again, the FDA in 2016 eliminated the requirement to report much of this. This is why this study is so significant, because it looks at all insurance claims, 865,000 of them between 2017 and 2023. So just to be clear, your commitment is you will do a safety review, you will look at this top to bottom, you will take this data into account. Do I have that right?
I believe the Secretary is already committed to that, and I will I will promise you to fully support that.
Good. Okay. Let me ask you about your work on conscience protections in an earlier administration. I think one of the Bush administrations, the Bush 43 administrations, you worked on conscience protection rules for healthcare providers. Do I have that correct?
Yes, that's correct, Senator.
Would you support reinstating and fully implementing conscience protections for healthcare providers?
That would be up to the Secretary and the President, but if they decide to go in that direction, I would know exactly how to do it.
Would you advise them to do so?
I believe I already have, Senator.
Good. And that should be easy because the Secretary, when he sat right where you were sitting, said unequivocally that he supported conscience protections, that he would put them back into place. The President said he supports conscience protections. In fact, the President had them in place in his first administration. So I'm glad to hear that. We'll hold you to that. Let me talk to you for just a second here. Well, actually, all right, Mr. Chairman, I see I'm out of time, and I'm always so good about obeying my time limits, aren't I, Senator Kane? I'll have a few. That's a joke. I'll have a few more questions for you for the record, Mr. O'Deal.
Thank you,
Mr. Chairman.
Here's what happened. Senator Hawley brought up an enormous new study, the largest ever on Mifepristone. That's the so-called chemical abortion pill. This was a study of 865, 727 abortions between 2017 and 2023. That's not a tiny sample, folks. That's almost 1 million cases. And the results? Absolutely frightening. This study found that nearly 11%, that's 1 in 9, of women who used Mifepristone had a serious adverse health event. We're talking about things like sepsis, infection, hemorrhaging, ER visits, and even life-threatening situations. That's not rare. That's not safe. That's a public health crisis. Now, here's the kicker. The rate of these serious complications is 22 times higher than what the FDA, the agency that's supposed to protect us, currently reports. Why is that? Well, in 2016, under Obama, the FDA eliminated the requirement for doctors to report anything except for the most extreme, life-threatening cases. So if a woman nearly bleeds to death but survives, that's not even counted. The Biden folks have taken it even further, making it easier than ever to get these pills with zero oversight. Let me be clear, this is not about being anti-woman or anti-choice, as the left loves to say. This is about truth. This is about safety. And this is about transparency. Senator Hawley demanded that the nominee and the HHS secretary do a full safety review and actually look at the real data. And the nominee? Well, he didn't exactly jump at the opportunity, but he did say he'd support a review. Folks, let's hold him to that, because there are lives at stake. Let's talk about what's changed. For 20 years, there were strict protocols around this drug. Only a physician could dispense it. In-person visits were required. Follow-up care was mandatory. But under Biden, all gone. Now, you don't even have to see a doctor. You don't have to be in the same state. Heck, you don't even have to be in America. You can order these pills from overseas without a real medical evaluation. Is this the kind of health care we want in this country, where women's safety is tossed out the window in the name of access? I'll say it. This is reckless. This is dangerous. Asterisk, asterisk, and the left wants to pretend it's progress. Here's what I think, and what every true patriot should demand. 1. Reinstate the reporting requirements. We deserve to know the truth about the risks. 2. Bring back real safety protocols. In-person medical care, physician oversight. This is basic common sense. 3. Protect conscience rights. Senator Hawley brought this up too. No American doctor or nurse should be forced to participate in abortion or be punished for following their faith. That's not just good policy, that's basic American freedom. The left keeps telling us to follow the science. Well, here's the science, plain as day. This drug is a lot more dangerous than they want to admit. Why are they covering it up? Why are they putting ideology and profit over the safety of our mothers, sisters, and daughters? So what can you do? Share this video. Contact your senators. Demand oversight and accountability. We cannot let unelected bureaucrats and radical activists run our healthcare system or risk the lives of our women in the name of choice. Let me know what you think in the comments. Have you or someone you know been impacted by these changes? Do you agree that we need to put safety first? Let's keep this conversation going. Thank you for tuning in, Patriots. Don't forget to like, subscribe, and ring that bell for more truth the mainstream media won't tell you. Stay strong, stay informed, and God bless America.